Jackson 16 WAPT News begins with breaking news.
Thank you all for being here today on Monday. We know that Mississippi is still battling the deadly coronavirus. I will tell you that, and it's all anecdotal, but I have seen a tremendous amount of participation and increased focus from the people of this great state. It makes me more and more confident that we can and that we will emerge from this virus even stronger. Mississippians, by and large, are stepping up. They are taking extra steps to protect themselves and to protect their families. All of us know somebody who is vulnerable to death from this virus. We all have the ability to suffer tremendously. And it takes all of us working together to prevent those tragic outcomes. Our order on bars went into effect this weekend. I'm looking forward to examining the data to determine the outcome of that effort. We know we're not going to see tremendous progress over a 24 or 48-hour period. It is a combination of a large number of things working together that will help us slow this virus. We know that a large amount of our spread has been occurring amongst young folks, amongst folks who attend bars, and amongst folks who often are making reckless decisions. Combining alcohol and close quarters is a dangerous proposition when it comes to this virus. I'm looking forward to reviewing the school reopening plans, those that are due at the end of this week. I'll be researching and reading them closely. We know that it is essential for children to get a quality education, especially after missing so much time in the spring. Think about it. For some of our kids across Mississippi, they have now gone 5 months without any significant learning opportunities. March, April, May, June, and July. We cannot allow those kids to fall further behind. We also have to work to provide the safest possible environment. All of that work is ongoing and urgent, and I look forward to seeing the plans that are put forth by various districts. I've heard anecdotally that this district is going to do this and this district is going to do that, and some say they may not let kids back in their schools for a long, long time. I want to see what every different group puts together, every different school district, and we'll make decisions accordingly. If we have learned one thing over the last 6 months, it is this: we must not ignore the risk of the virus or the risk of shutdowns. Both paths carry heavy, heavy cost. We must be willing to be innovative, and we must be willing to think outside of the box. We cannot do things the way they've always been done. Apathy is the only thing that is off the table at this point. Oftentimes, many of you ask me in these press briefings, would I consider X? Would I consider Y? Would I consider Z? The answer to your question is going to be yes. I would consider anything that I believe will help slow the spread of the virus so that we can more quickly get back to a more normal environment for our young people and for all 3 million Mississippians. With that, I'm going to turn it over to Dr. Dobbs to give us an update.
Thank you very much, Governor. Today we're reporting 653 additional cases with 6 more deaths. Wouldn't be too comfortable with the 600 number. We frequently have a little bit of a drop after the weekend, so we'll just follow subsequent days to see what's happening, but certainly would not take this as an indicator that we've seen much improvement yet, although certainly we can be hopeful. If we look at what else is happening in the state, if we look at our hospitalizations, we still can see some tightness within the hospital bed availability, although it does seem to be stable. We have 9 major medical centers in the state with 0 ICU beds available. One of the things that's been very helpful is we've seen over the past week, we have over 300 less non-COVID patients in the hospital, making room for more and more coronavirus patients. And so that has helped out somewhat. We've had a more modest decrease in non-coronavirus ICU patients. It's 21 less this week compared to last week. And for our coronavirus patients, we've had a modest increase over a week from 293 to 304. An increase, but not, stratospheric sort of rise. And relative stability in our floor bed patients, so people not in ICU, from last week it was 942, and this week it's 949. A couple things I think that are worth just mentioning real quickly. We have been looking at our information, and I've been personally calling different coronavirus patients who we've identified in the past week to get a sense of what's going on now with who's getting coronavirus, how they're feeling, and how did they get it. A lot of folks that I talked to this morning had pretty common symptom complex, and a lot of them was pretty bad. They had a high fever, body aches, severe back pain, which is something we've seen quite a lot, especially when we were looking at the Capitol Complex outbreak. And then certainly people who've lost taste or smell. If you have a sudden loss of taste or smell, it is almost certainly going to be coronavirus. That's about the only thing that's going to do it to you. Some people were more sick than others. Some were hospitalized, some were not. But if we look at how do people get it, pretty clearly there's some common threads that we've identified. And the most common thing that we've seen, about 80% of the time, it was a social gathering where people let their guard down. It might be a funeral. It might be an extended family get-together. You're not going to wear a mask around your cousin who comes in from out of town. It's going to be with nephews. It's going to be going to maybe a close friend's birthday party. Those sorts of things are what we're seeing. So it's not even so much nuclear family, unless someone goes out and goes to a social event and brings it back. We'll try to do more and more sort of numerical analysis, but the social gatherings really do seem to be getting us. Of course, there are work exposures and things like that, but it's the social gatherings where we let our guard down and we feel like, it's appropriate for me to be more personal, to breathe other people's air, to touch other people. And sometimes they're not very large gatherings. Sometimes it's 5, 10, 15 people. So it's not like it's a massive group of folks. So really just please be very careful right now. Mostly stick to your own nuclear family as much as you can. And if you're around other people, remember, there's a good chance that one of those folks has coronavirus. And we need to take every precaution while we get through this current surge so that we can hopefully be in a better spot in the next few weeks. Thanks, sir.
Thank you, Dr. Dobbs. At this time, I'm going to turn it over to Director Michelle, who's going to give us an update from the emergency management perspective.
Thank you, Governor. Good afternoon, everyone. We are rapidly approaching August the 3rd, which is going to be the open application period for the COVID-19 County and Municipality Emergency Relief Fund. We have a couple of things that we're working on that will also come about on the 3rd of August. I'll be providing more information the later we get in the week, but bottom line is our help desk that we've talked about to help walk counties and municipalities through that process will be open and operational on the date of our application period. And again, that application period will run from the 3rd of August until the 15th of October. It is important that you do your planning up front. Don't rush putting your packets in early on, but I certainly recommend that you get those packets in well before the end of the application period so we can get through those applications quickly and get money to you in the most expeditious manner that we can. Second thing, just a reminder that FEMA is conducting webinars. They started today. They will run every day this week to assist counties and municipalities with the public assistance process. Those of you that are not familiar with that, FEMA is trying to assist and help with the familiarity of the PA application process. If you're not able to make those webinars, there will be videos available. All of that information is available at MEMA's website at msema.org. And then finally, this tropical update. Our tropical storm that we were watching, Gonzalo, dissipated this weekend, so that one is no longer a threat to us. We are watching an IVAS system way off the coast of Africa that is moving. Currently, the models on that are projecting it to move off into the Atlantic, but we'll continue to watch that over the next few days. So hopefully, other than some rain throughout the remainder of this week, going into the next week, nothing thus far. We'll keep our fingers crossed. Governor, that completes my update, sir.
Thank you, Director Michelle. I do also want to just point out one thing that either has been announced or will be announced later today. We have worked with the United States Treasury Department, and I want to personally thank the Trump administration as well as Secretary Mnuchin and his entire team. We have gotten approval for a Restore Act grant award of $6.67 million for and to support Pearl River Community College's Workforce Training Center in Hancock County. This is something that I am exceptionally pleased to announce for a lot of reasons, one of which is it was Senator Moran and I back several years ago that worked with Pearl River Community College to initially acquire the land on where this Workforce Training Center will go. To me, this is a prime example of why it's so very important for the governors to have the ability to work with local officials, to work with the federal government, to leverage all resources to maximize our investments in our communities throughout Mississippi. It's the very reason that Senator Moran and so many other great state senators on the Mississippi Gulf Coast have been fighting to make sure that we maintain that. It is that fight that has led to the Department of Marine Resources on the Mississippi Gulf Coast having been shut down, unfortunately, but hopefully we'll be able to get the legislature back in sometime very soon. We'll get DMR's budget passed in the same way that the House passed it during the regular session, which is the way in which the Senate wants it to become law, as I appreciate it. But again, this is just an example of every person on the Gulf Coast benefiting from the Restore Act and benefiting from the Department of Environmental Quality and the governor having a relationship with the Congress as well as the Trump administration. So again, I want to thank everyone that's worked hard on this. It's going to be a big deal for workforce training in Hancock County, and I could not be more thrilled than to announce that today.